Appendicitis symptoms, causes and treatment. Appendix is a small finger-shaped pouch structure present connected to the colon, on the right side of abdomen. Appendix is non-functional in humans and is the vestigial organ that had a role of digesting plants in our forefathers. In the current human system, it is probably dedicated to possess friendly bacteria environment that aids in fighting off infections and facilitating digestion. In appendicitis, the appendix becomes inflamed, swollen and get filled with pus. Appendix mainly affects people between the age of 10 to 30 years but has a possibility of occurrence at any age. The treatment involves removing this organ through surgery, and around 250,000 appendix surgeries are performed every year in US. Removal of appendix is not associated with any alterations in the digestive system. The appendix is a closed-ended narrow tube connecting to the colon. Appendicitis is caused by inflammation of the appendix. The inflammation can happen because of building up of mucus in the appendix. This makes the stools hard, leading to infection of the area. Signs and symptoms of appendicitis may include vomiting tendencies. Are you having regular sensations of vomiting? Has it become more than frequent without any reason and out of the blue? You should be aware that vomiting is one of the early signs that are associated with the problem of appendicitis. Though, it is important to look into other symptoms as well, but this is definitely one of the prevalent ones.
Sharp pain in the abdomen. The first and the foremost symptom that might make you feel that something severely is wrong with you is that of a sharp pain in the lower right side of the abdomen. Usually the pain is unbearable and you might want instant relief using painkillers. The pain usually comes in pangs and makes a person lose their mind.
Rise in temperature. The intolerable pain usually leads to rise in the body temperature. This can usually go to 100 degrees Fahrenheit or more in many cases. Fever is definitely one of the signs of appendicitis if it is accompanied with pain and other symptoms. Once you face all this, it is best to get a testing done as soon as you can. This can also be followed by chilly sensations.
Diarrhea or constipation. This might differ for different individuals. Some might experience severe forms of diarrhea when undergoing the ailment of appendicitis, while there are others who might complain of constipation in this situation. No matter which one you undergo, it is one symptom of appendicitis that you need to note down will occur with the rest.
Appetite loss. Are you suddenly not feeling hungry anymore? Are you facing a loss of appetite along with severe pain in the right side of the stomach as well as vomiting and fever? If yes, then it might confirm that this is a sign of appendicitis in the body. You need to understand that this is one sign that easily contributes to the main issue.
Discomfort near the belly button. Way before you start feeling severe pain in the lower abdomen area, you will experience a lot of discomfort and pain near the belly button. This gets worse when you put pressure in the area in the form of coughing and sneezing or even during a car ride.
Gastric and bloating issues. A lot of people complain of having a gastric and bloating issue when they were later detected by appendicitis. Though, it might not occur in all, it does occur in some rare cases and can be stated as a symptom. Causes of appendicitis. Infection. Infections of the appendix could be bacterial or viral. Infections have a way of affecting any organ in the body. Inflammation may occur that leads to swelling and pus formation. In most cases, stomach infections that are untreated may migrate and find their way in to affect the individual's appendix.
Obstruction of blood supply to appendix. Bacteria that are killed by the gastrointestinal tract sometimes tend to remain in the body because of certain reasons. They are not excreted in feces and hence may clog or block the blood supply of the appendix. The bacteria in the stool will also cause infection to the appendix. With a hampered blood supply or obstructed artery, the appendix will develop an inflammation and give pain to the individual.
Trauma to lower abdomen. Any mechanical trauma or injury, as well call it in normal terms, on the area of the lower abdomen may cause the infection of the appendix. Due to the hit, the inner structures like other organs, arteries, veins or nerves around the appendix might be damaged, so the effect migrates towards the appendix and causes problems there.
Cancer. Certain malignant conditions in which the tumor gets metastasized into the blood flow and hampers the functioning may cause appendicitis. Appendix may be a vestigial organ, but when it is affected, It leads to a lot of pain and trouble to the person.
Disorientation of the appendix. The tail of the appendix is supposed to be directed towards a certain direction while it is normally presented in the human body. The positions that is it directed towards is 11 o'clock position, 1 o'clock, 3 o'clock and 6 o'clock position. Any movement due to external trauma or some irregularity inside the body may lead to alteration in the direction of the appendix and may result in appendicitis.
Blockage. There is a possibility of certain obstruction inside the lumen portion of the appendix caused mainly by feces deposition. When hard and rigid stool section gets trapped in the appendix, the bacteria from the stool infect the appendix, resulting in appendicitis.
Traumatic injury. Any trauma or severe injury of abdomen can result in appendicitis in certain individuals. It is considered as a medical emergency and needs prompt treatment. The symptoms develop as progressive and worsening appendix pain with painful sneezing or coughing.
In case of immediate treatment, people usually get recovered without much difficulty. But, in case of delayed treatment, appendix tends to get burst, causing severe infections that may even result in death. Appendicitis treatment involves the most acute surgical emergencies pertaining to the abdomen.
Best treatments for appendicitis. Consume vegetables rich in vitamins B, C, and E. According to medical science, vitamin B, C and E plays a vital role in managing appendicitis. Therefore, the patients should use enough vegetables like cauliflower, peas, beans and broccoli, which are best known to be loaded with these vitamins. Cook these vegetables and eat it both during lunch and dinner. In fact, some of the dietitians suggest these vegetables can be used during breakfast as well.
Carrot and cucumber salad. Carrot, cucumber and beetroot are rich in fiber and other nutrients. Cut these vegetables into small pieces and mix them thoroughly. Add salt to taste. You can also garnish it with coriander leaves. Take this salad as a part of lunch and dinner. After taking this salad, drink 1 glass of buttermilk. You can also add 1 tablespoonful of bar's juice to the buttermilk. Continue to take this medicine for at least 20 days. Wheat germ and bran. Take 1 cup of whole wheat powder and ½ cup of wheat germ and bran. Add ½ teaspoon sunflower oil and salt to taste. You can also add green leaves cut into small pieces. Now mix them thoroughly, add enough water and make it hard dough. Roll the dough on a plate. Heat the pan and put the rolled dough over the pan. Cook till the roll turns brownish. You can eat this delicious recipe along with vegetable salad.
Brown rice. Brown rice is rich in nutrients. Cook brown rice and green gram. Now, mix it with a salad comprising of cauliflower, peas, beans and broccoli. You can also use green leaves along with the salad. You can also mix brown rice with buttermilk and salt to taste. That would be a wonderful recipe too. Make sure you drink plenty of water. Dietitians suggest brown rice should be taken twice a day for about 15 days.
Green gram powder. Take 1 teaspoon of green gram powder. Mix it with about 10 teaspoons of cold water. Drink this mixture at least thrice a day. Instead of green gram powder, you can mix sweet germ with water. This is also found to be highly effective in managing appendicitis. This medicine should be taken for at least 15 days. The dosage of this medicine should be appropriately increased depending on the severity of appendicitis.
Cucumber juice. Take about 10 teaspoons of cucumber juice, 10 teaspoons of carrot juice and 10 teaspoons of beet juice. Mix them thoroughly. Drink this juice at least thrice a day. Depending on the severity of the appendicitis, dosage can be increased. You can also add this mixture to 1 cup of buttermilk. Now, take this medicine at least thrice a day.
Thank you for watching. If you like this video, please hit like and subscribe for more videos.